In hospitals across England, junior doctors are facing the hardships of a 4-day strike, estimated to result in 250,000 appointments, operations, and other healthcare services being cancelled. Thankfully, the British Medical Association and NHS managers have taken patient care seriously and have had guidelines set in place to handle such an event. Matthew Taylor, the chief executive of the NHS Confederation, has said, "It is heartbreaking that this is happening, due to the conflict between the doctors and the government. The longer duration of the strike will prove to be even more disruptive than previous events, leading to 175,000 cancellations. /n/n To better understand the makeup of the two sides of the dispute, we must examine the proposed changes the British Medical Association is pushing for. They are currently campaigning for a 35% pay raise for the junior doctors involved, which will result in many making over £20,000 annually. On the other hand, the Secretary of State Steve Barclay does not see this increase as reasonable and suggests that it exceeds given boundaries. His plea to patients is to attend their appointments unless told otherwise and to call 999 in emergencies. /n/n So what has caused the discontinuation of such vital services? For starters, the real terms pay of junior doctors have decreased by a quarter in the past 15 years. To illustrate this, the BMA has recently released an ad depicting 3 healthcare workers involved in a surgery removing an appendix, with 1 having 10 years of experience, and 2 having 7 and 1 respectively. The pay for this specific procedure? A mere £66.55 when split between them, which goes to show how undervalued our healthcare workers are. Thus, they have been left unable to negotiate with the government due to their low wages and are now resorting to fighting through what might be the longest health service strike we've known. /n/n For patients, the best course of action in respect to the doctors is to abide by the government's guidelines as stated. That includes attending every appointment and resorting to emergency services as and when needed. As for the junior healthcare professionals, our support and fundamental understanding of their grievances against the state is necessary. Let's hope that amendments are made in the future so doctors do not have to resort to such drastic lengths to ensure their pay is enough to get by.